You're watching CTOM TV. Knowledge is power.
So I'm just going to get into some testing and what testing is all about for this. If you could cue slide one.
Oh, sure.
So the standard testing is what we call reverse transcriptase PCR, polymerase chain reaction. We were looking at 3 different proteins, but now we're looking at 2 different proteins. I don't believe CDC is suggesting we look at the spike protein anymore. So for COVID-19, it's 2 different proteins that we are concerned with. So the process is basically what we'll do is we'll collect the sample, so we'll collect a sample of it, and then we'll ship it off in a container, and it goes off to the lab, and then the lab will isolate the RNA. The RNA gets converted into cDNA, and then we do the polymerase chain reaction, which uses primers or sometimes color probes, such as TACMAN kits that use Vic and FAM antibodies to cause a light-based response when you have that. Okay. And then that's read, and or you can use a gel, traditional gel, and just look for those amplified proteins.
Okay.
So this is a laborious process. It requires a respiratory specialist lab, and this is people who are well protected to take the samples. Mm-hmm. So you can't get tested in your regular doctor's office as you do with a standard influenza or a standard process. You can't go to the hospital and get tested. Mm-hmm. You have to have a specialized crew to test you. Mm-hmm. And then, of course, the transport of live viruses is going to be prohibited across borders. Mm-hmm. So you can't really just use testing facilities anywhere in the world. You have to use testing facilities in your own country. Mm-hmm. And then, of course, transporting these samples, they have to be on ice. Mm-hmm. It's a very costly, laborious process. Mm-hmm. And, it's just not the best way.
Thank you for watching CTOM TV. Subscribe below and stay informed.